Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Commode Cancer Foundation, in partnership with AIT. Together we fight, together we win. Thank you all for joining us to champion our cause. This morning we have a special guest, and today we're going to be talking about male cancers. So, firstly, let me just Dr. Salako, good morning, and I hope you can hear me. You're looking good.
Good morning. Yes, I can.
Thank you.
So do you.
You are doing the red, I'm not. Can you imagine? I wasn't even thinking about the red at all. Just in my own matter. Let's go. So today we're going to be talking about male cancers, and we're going to be chatting. So let me put it this way. They will chat with the people's oncologist. That's what she's popularly known as. So if you want to look for somebody, just go on any of the social media and look for somebody they call the people's oncologist. That's who we're chatting with today. Probing on the male cancers communication, anything to do with males. And what are they? The most common male cancers are prostate, lung, colorectal, bladder, and melanoma. See, I'm not very good. I always tell you,
melanoma.
I'm not very good with all these their science words. So just let me respect myself. My own is education. My doctorate is not medical. Medical people are talking today. So let's go. So That's what we're going to be talking about. So today our quest is for us to get some information from Dr. Salako on these key things. And what are they? What men need to know about male cancers and which ones affect them. That's one of the key things we want to be looking at. And so let me not talk too much. World Cancer Day, as this month, we're trying to close the care gap. We're trying to unite against cancer. Those are our key hashtags in this month. Please, those of you following us, can you please find it and join us as we try to get cancer out of the world? No matter how hard, we will try. Let's start this conversation. Who is our guest? Dr. Salako, you're the one now.
Yes.
So the people's oncologist. Dr. Salako is a prominent figure in the global health and cancer research, a senior lecturer at the University of Lagos College of Medicine, boasting over 20 years of dedication to oncology, ranks among Nigeria's top 90 clinical oncologists. A University of Lagos alumni, she focuses on research, teaching, and enhancing cancer care at her alma mater, while pursuing ventures like Sebelsi. Is that correct? I knew you were going to laugh. I respect myself. Is that correct, though? Sebelsi. How do you pronounce that word? Shebekli. What country language is that?
That's a long story.
Okay, then. Let me keep going. Shebekli Cancer Care and Pearl Oncology Specialist Hospital, providing accessible cancer treatment across Lagos. Notably, Dr. Salako, Uncle Paddy. If you've seen Uncle Paddy, that's what it is. Uncle Paddy Cancer App aids patients and clinicians in informed decision making, while her team's AI-powered ProsCare app, she's going to tell us about that a bit. ProsCare app monitors cancer patients' treatments, side effects, benefits, and hundreds across Nigeria, earning her a prestigious accolades, which are recognition by the American Society, that's ASCO.
Yes.
American Society for Clinical Oncologists, and the Global Bridge Oncology and Pfizer Global Medical Grants Awards. Welcome, Dr. Salako. Thank you for joining us. I tried, I read this thing well. I read it, not too bad. Okay, let's start this conversation. Thank you all for joining us once again. Together we fight, together we win. We're going to be starting this conversation, and we're going to start as normal with our nice and easy questions of understanding the real conversation we're having. So what are cancers? What are the cancers associated with men, and what are their signs? Men, it's for you today, and it's going to be for you for a long time. Come on in.
Excellent. So thank you, Dennis. It's really a pleasure to be here and with your audience. And it's coincidental that today is Valentine's Day, and because we love our men, it's really a pleasure to talk about a topical issue around men and cancers, because when men have cancer, it's disheartening, it's heartbreaking, and you just see how the family dynamics change. So for a start, I think it's important to, identify that. And I agree with you that prostate cancers, lung cancers, colorectal cancers are the most common cancers affecting men here in Nigeria, and especially many African countries. Prostate cancer ranks one of the top three. In other countries, in Europe, for example, it will be lung cancer. But here in Nigeria and many parts of Africa, it is prostate cancer. And the most common symptoms of prostate cancer are to do with peeing, how men urinate. So the usual thing is when a man wants to urinate, when he feels pressed, he can go to the toilet without peeing on himself. So some quick symptoms are around, all of a sudden he's peeing a lot. Maybe in a day he pees 3-4 times, or all of a sudden he's peeing about 7-8 times. Or he has to rush to the loo, to the toilet to urinate. Or when he gets to the toilet, instead of, starting to urinate, he's already peed on himself. Or a lot of urination at night. Now, it's important to say that these symptoms I just listed may be due to other cancers, maybe due to other conditions like diabetes mellitus, UTI. But again, these are the common symptoms associated with prostate cancer. Other cancers like colorectal cancer usually starts with a change in bowel habits. So everyone has a bowel habit. Some people poo once a day, every day, while some people poo once every 2 days. By the time you're an adult, you sort of know what your bowel habit and pattern is like. But with colon cancer, the habit changes. Instead of someone who poos once a day, all of a sudden they notice diarrhea for a few days or weeks, then it returns back to normal. Then a few months later, it changes to constipation, where they're unable to poo, or when they poo, the stool is really, really hard. For the third common cancer, which is lung cancer, for example, non-Hodgkin's lymphoma. For lung cancer, the symptoms are usually very, very quiet and vague. And usually when a man starts coughing or complaining of chest pain, it's sort of advanced with lung cancer. So I think just to touch on non-Hodgkin's lymphoma, that's really when some swellings around the body, the neck, the armpits, the groin area, all of a sudden pop up, and there's a history of weight loss. So I would say those are the common cancers affecting men.
Thank you. It's very interesting the way you've made it sound so simple, and all of a sudden you've put me on an assignment now, because you've now highlighted why we need to have to discuss these 3 cancers in the next 3 discussions, because there's no point talking about them in bits and drabs, but to actually address them as they go along. Okay, so let's go. So the treatment options of these cancers. Before as I'm asking about the treatment, I'm going to ask you about what are the procedures to treat it, because we know how to treat it, and then we also need to know what we're looking for. So you've explained the signs and all that. Let's go. The treatment options tend to be very daunting for men. And I think it's more to do with the conversations that people have about the treatment and all the things men all of a sudden can't do. Like we said, it's Valentine's Day today, and then all of a sudden somebody's told he can't. The impression. I'm not a medical doctor, so I say it. The impression is that if you have prostate cancer, for instance, you will not be able to be actively engaged with your wife. And those are a lot of the main things that make people not want to know. So can you help us now ease the tension for men on this particular day as we talk about?
When we're treating cancer, we have to treat the person as a whole human being. And when it comes to men, no matter what their health condition is, you have to be conscious that they're very particular about their reproductive system, their sexual abilities and capabilities. And you have to be transparent and upfront. And sometimes you have to repeat the conversation around how cancer care will impact their sexual function. So I don't think there's any oncologist who talks to a man about prostate cancer that doesn't talk about the impact of care around that sexual function. In fact, before you talk about it, the man brings it up. It's a big critical issue that must be addressed. And sometimes the man's preference for preserving his ability to, rise up in the bedroom determines the type of care he will receive. So sometimes we're saying, we want to do this, we're recommending this treatment, and the man is like, not me and you. But again, when we are treating cancer, because it's a life-threatening disease, it's important we put his life first before his, his ability to perform in the bed. When we talk about treatment for prostate cancer, and this is generally for all cancers, we do not treat cancer in one way. It is usually multidisciplinary, meaning that many cancer doctors will sit together to make a decision. For example, when I'm treating prostate cancer, I have to collaborate with a urologist. And a urologist is a specialist who treats men with reproductive issues, such as prostate cancer. And they do the surgery, they do hormonal therapy. I'm an oncologist. I would do chemotherapy and radiotherapy treatment, and also hormone treatment. And the critical thing is, look, if you know someone or a man, living with cancer, the first thing you should notice the decisions you are making. Where are you making them? Has your medical decision been made with a multidisciplinary team? Because at the beginning of treatment is the best time to treat. If you miss that opportunity by one doctor treating the entire cancer, then the outcome of treatment is usually poorer than when compared to when a multidisciplinary team makes the decision. So surgery is key. So if it's prostate cancer, we're trying to remove the mass in the prostate, and we have different techniques used. It may be invasive, where the surgeon cuts through and does the open surgery, which is outdated, or it may be laparoscopic, where it's just a tiny, like a pen wire put through, and within 3-4 hours, the surgery is over. Chemotherapy, we usually need to do chemotherapy because with prostate cancer and many other cancers, when they present with an advanced stage, we want to give treatments that goes through the entire system. So we inject chemotherapy into the system to attack the cancer cells wherever they are hiding. Then the third treatment is around radiotherapy. Because we know cancer is very troublesome, even in the hands of the best surgeons. The surgeons go in, remove the cancer, but cancer is so troublesome that it leaves microscopic cells that the eyes cannot see. And so we need to follow up surgery with radiotherapy, and that's like a super-powered light that shines on the scar after surgery, on the area after surgery, to sterilize any tiny cells that the surgeon sort of missed. And so we've talked about surgery, chemotherapy, radiotherapy. The fourth treatment is around hormone therapy. Some cancers, like prostate cancers, are driven, are fed, they get bigger, they get more aggressive when there's hormone in the body. And the truth is, every human being has hormones. So when we are dealing with a man who has prostate cancer, we usually will talk to him around the testis produces the bulk of the hormones. We need to get rid of the testis, and that's where the clinic goes like, of all the things you want to remove in my body, is this testis? Nah. So sometimes we have to go the other route. Instead of doing surgery, removing the testis, we have other drugs we give that sort of knock out the function of the testis, reduce the hormone level, which reduces the food being given to the cancer. And the fifth treatment is target therapy. A lot of research and science has been done, and there's a lot of investment in finding the cure for different cancer treatment. Whilst we don't have a cure for most of the cancers that present late, we know enough to target certain things in the cancer cells. And so when people come in for treatment, when men come in for treatment, depending on their stage, depending on their preference, depending on their financial capacity, all of that determines what type of care they will receive. I feel I didn't answer the B part, but I'll leave it to you.
No, actually, you have answered the question so nicely. Even I am actually thinking so as to, I've been doing this thing for years, and I'm thinking, oh wow, this is making the thing so easy. To our viewers, I hope you're getting it. Together we fight, together we win. Oh wow, this is nice. I got it. So just to recap, all those things, and to all those who are just coming into the cancer space, all the treatment options that Dr. Salako has explained, I have been through, and I am in a lot of them. So please do not run away because you've heard them. I am there and I am still here, and this is my 8th year. Just do it. Don't run away from it. I am begging everyone. For as long as you can, please just do it. Don't throw them away. You'll be so surprised. It gives you life. Okay, let me go to the next question. The morbidity rate, right? Death rate on cancers generally. So it's not about just this. Especially those linked to men are high, right? And as compared with those linked to women. And I would say my view is because women are more open to take things like breast removal things off, as against men and the issues with the prostate and not being able to happen. Although that's my view, right? So to be precise, please, can you speak to men? This one, speak to men direct on why they need to understand their responsibility to care for themselves. And I use that with all sense of humility because of children that I have over the years met and known that the father didn't take the treatment and ended up with the child becoming an orphan. Is that the word? Yeah, an orphan, which is not necessary. And so this is an appeal to men, and you're going to help me do this.
Okay, so I think this will be a special, if I could, give you guys a poem, the men, I would say, we love you so much, and a lot of our men are, of course, the head of the family, of course, provide, of course, have to man up, even when they're scared, sometimes put their symptoms, push it all the way to the back because they need to make, they need to hustle, they need to go to work, make money for the day, but herein lies the essence of life. You must really take care of yourself even when you do not have any illness, starting with your medical checkup. It's an investment in yourself. Some cancers are preventable. For example, prostate cancer. If you understand your family history, if someone has had prostate cancer in the family, if you are a Black man, these are the risk factors of prostate cancer. Mm-hmm. If you're on the big side, like you're obese, it's important that once you're age 40, you should start your PSA test. You can't ignore it. You can't wait until waterworks problem starts, like you can't pee before you visit the hospital. It's important that when you notice a symptom, for example, maybe weight loss, chest pain, cough, which may be due to anything, present to your hospital. It's important you have health insurance, sort of safe for the rainy day. Health insurance is something that a lot of people don't invest in because they don't see the need to. I'm not ill, why am I putting money aside? And the money will roll over. As men, it's important that you plan for the future, not just financially, but also health-wise. I would also say when you don't feel fine, it's okay to speak up because a lot of men come into the clinic, with advanced disease. And what I love about our men is they usually come in with their women, and you can see that this man has taken care of his family, as in the way, and this is what I say, a good man, a great man, when he comes into the clinic. He will come with people that are just purely in love with him. And sometimes you will find this man just walk into the clinic all alone. Not as if they don't have family members, but sometimes they've not shown enough love when they were healthy. And now that they are ill, it doesn't come natural for the woman or for whoever to stand beside the man. So please, this is also a message to men that you don't have to get old before you determine if you've lived a good life. You can start from today by taking care of yourself, investing in your medical checkup. You can save 5,000 naira or $5 per month. By December, you put the money together and go get your medical checkup done. If you're able to pay out of pocket immediately for your medical checkup, go get it done. Get your medical insurance, show yourself some love, rest, drink water, rest. Sexual practices, do not have multiple sexual partners, because that in itself, is a risk factor for different types of cancers that are associated with viruses like hepatitis B virus. And that's something I would like to quickly mention. Liver cancer, for example, is associated with hepatitis B virus, chronic infection. And last year, I treated about 6 patients, 4 of which were men with liver cancer, and they had hepatitis B virus infection for about 8, 10, 20 years for some of them. And they didn't take it seriously because it wasn't symptomatic,
Remember, there's only one race, and that's the human race, okay? Oh, hail my Jesus.
Team. You have a support system within your home. How you feel, you should be able to tell a few people, not the entire family, but sometimes just a few people that will support you and help you make the right decisions. Sometimes when the chips are down, it's as bad as sometimes when men are ill. You would find people rise up for the first time and they're asking the weirdest questions, like they have not, you will see that the family is just disconnected, if I can put it that way. So first of all, charity and love begins from your home. Show yourself love. Show your people around you love. Invest in yourself in terms of your health. And when the chips are down, if you have a health condition, show up to the hospital early, where doctors have a better chance at treating the cancer rather than palliating. So a lot of times, because our patients present with advanced disease, we usually don't have the opportunity to treat aggressively. Our goal is to control the disease, stop it from growing too fast, and then we take care of many, many symptoms.
Doc, I'm glad we had this conversation, because the way you're putting it, you're making it make sense. I'm going to ask you another question, but when I'm looking at it, I'm thinking men are come across as very strong, and yet they don't handle illnesses very well. But before I go to that, I'm going to come. There are 3 groups of people that I always want to speak to face to face on this thing. Sometimes it's just a one sentence. It's just something that they must take away from this today. One of them is, what's the government going to do for us? When I always use, and I'm very, very happy because I use the word us. So people understand that I also see myself as in this thing together. So a sentence that will target the government, so the government can understand that this person sitting here maybe looking nice, but cancer is cancer, and it's not easy. We all struggle with it. The citizens of Nigeria, the NGOs, all of you do a lot of work for us, a lot of work, and we can't lie. It may not translate what you see, but to those of us that receive the support, we know and we appreciate. And the last one will be for the men themselves. One thing that you want them to take away from this now and hold on to it.
So to the government, I would say thank you for identifying cancer as a disease to be tackled. And it's important to give the government their accolades with the new cancer centers they're building, with the cancer health fund that, patients can access up to 2 million naira. So we say thank you. However, every year, more than 80,000 Nigerians die from cancer. So we need the government to speed up and prioritize cancer care. If they were planning 2 cancer centers, we need them to give us 10 cancer centers. We need a national cancer control plan because 40% of cancers are preventable. Liver cancers, prostate cancers, cervical cancers, no one should come with such cancers. Let us use our talent and our resources to treat the cancers that we can prevent. And through our cancer control programs, that provide breast, cervical, prostate cancer screening, we can detect our patients at stage 1, stage 2, where they have the ability to, where we, the doctors, have the ability to cure. So it's to thank the government and to say there's a lot of work and they need to speed up, especially with the resources available. For example, the NGOs have done phenomenal work and we are not as cohesive as we should be. And the government is able to leverage the resources within the country to reduce the death rate due to cancer. To the men, I would say this favorite quote, which is by Chanel Coco, and it goes like this: the best things in life are free. The second best are very expensive. The best things in life are your ability to sleep, breathe, eat. You don't pay for these things. You just are able to do it. Having good health is like free of charge. Why one person develops cancer and the other person doesn't develop cancer? It's not your doing. It's maybe nature's gift to you. So whilst you can maintain those things that are free, please invest in them. Sleep your 8 hours. Do your work, but don't die watching football like a few people did. Like, manage your stress levels, manage your environment, manage your finances. When you don't feel well, show up, show our women love. Men, go and vow your wife. Some men are going to eat breakfast, lunch, dinner today. The woman will cook it and the man will not even say thank you, talk less of giving her a gift. So I think that's my message. Like, show yourself love and show your woman love.
Awesome. Thank you. And Dr. Salako, can I just confirm you have a webinar coming up very soon?
Yes.
Can you just give us the title and how we can access it so that I can finish this segment?
Okay, thank you. So we have a cancer prevention webinar coming up, and in that 1-hour webinar, we're going to talk about how people can prevent cancer, how 40% of cancers are preventable and the steps you have to take. It's a Zoom webinar. If you go on our website, pearloncology.com, you'll find it there.
Thank you very much. Thank you, viewers. Together we fight, together we win. We've had a fantastic conversation with you, Dr. Salako. I thank you. It's taken me almost 1 year to get you on this television. I'm very grateful. It was quite a nice chat, honestly. I think that a lot of us out here have learned a lot from you. So to all our viewers, I want to thank you once again for joining us, for being part of this campaign to create cancer awareness across Nigeria and to help each and every one of us on this journey. You can follow us on our social media handles, Commonwealth Cancer Foundation. We're on Instagram, Facebook, anywhere, I don't know, LinkedIn, I think it's everywhere. I now don't know, I can't keep tracks anymore. So just Google Commonwealth Cancer Foundation, you'll find us there. And this video will definitely be up on our YouTube channel. Just give us a few hours. Thank you, and we look forward to seeing you again very soon. Doc, thank you for your time. We appreciate it.
Thank you. I salute you.
Everyone, we'll see you in 2 weeks. Our message is very clear. Together we'll fight. Together we win.